Did you know that hand washing wasn't always a medical standard? So picture this: mothers dying in the maternity ward, and there's one doctor who has actually figured out how to stop this issue. His colleagues laughed at him and they destroyed his career, and he ended up in an asylum. So this is a true story, and we're going to call this public health horror stories, okay? So in the mid-1800s, a terrifying illness known as childbed fever was sweeping through maternity wards across Europe. In a hospital, Vienna General Hospital, there were two maternity clinics. One staffed all physicians and medical students, and the other one was midwives. It was staffed strictly by midwives. Women became so afraid of the physician's clinic that some begged to deliver in the streets rather than being admitted there. The reason is because the death rate at the clinic with just the physicians and the medical students was dramatically higher. So a Dr. Ignaz Semmelweis couldn't stop thinking about one question: why were mothers dying here and not over there with the midwives? Semmelweis began observing the daily routines of the doctors and of the medical students. He noticed something no one else seemed to question. In the mornings, they would perform autopsies, the doctors and the medical students, and then without washing their hands, mind you, they would walk over to the maternity ward and deliver babies. So I actually lost audio here, but what I was saying is Semmelweis believed that something in the cadavers, something that he called cadaverous particles, was being transferred from their hands into the maternity ward when they were delivering babies. There were no microscopes proving bacteria, and there was no germ theory at this time, just an observation and a hypothesis. Semmelweis was able to convince the hospital to require the physicians to wash their hands with a chlorinated lime solution before examining their patients. The results were astonishing. Maternal deaths fell from around 16% to 2% within months. By today's standards, we would call that a breakthrough. His colleagues called it impossible. Many physicians rejected his findings. Accepting them would have meant admitting that they themselves had unknowingly caused the deaths of countless women. Without germ theory to explain why hand washing worked, Semmelweis struggled to persuade the medical establishment to make it mandatory. Years of rejection took a toll on his mental health, and in 1865, he was committed to an asylum girl. During his confinement, he suffered injuries that became infected, and he died from sepsis. This is the very kind of infection that he spent years trying to prevent. Today, washing your hands before caring for a patient seems obvious, right? But it wasn't always. One physician's willingness to question what everyone else had accepted helped to lay the foundation for infection prevention in modern medicine. Sometimes the most powerful public health interventions aren't the most complicated. Sometimes they're as simple as washing your